I've been doing bariatric operations since 2009, and initially I started with doing gastric bands, and then progressed on to doing gastric bypass, sleeve gastrectomy. Now I do endoscopic sleeve gastroplasty and offer gastric balloons, and then I'm in the process of introducing another technique called SADS. Hopefully, I will be able to introduce that technique within the next 2-3 months. Laparoscopic gastric bypass is an operation where the stomach is divided into a very small portion, which is called the gastric pouch, and the rest of the stomach is left behind. And the small portion, which is going to be the new stomach, the gastric pouch, is joined to the small bowel, which is approximately 1.2 to 1.5 meters downstream. So the advantages of this operation is it induces restriction because the new gastric pouch is so small, like the size of the fist, and then it is attached to the small bowel. So it induces malabsorption, which means not everything the patient eats is absorbed. As a result of that, they would have deficiency in some nutrition like iron, calcium, and very important nutritional elements like selenium, zinc, etc. won't be absorbed. That's why patients need to be on the supplements, extra supplements for entire life. And also they need blood tests to make sure their nutritional levels are adequate. There are great benefits from having gastric bypass operation, and one has to remember that the gastric bypass operation is a tried and tested over 40, 50 years now. It was introduced in 1970s. Before laparoscopic era, people used to have a big laparotomy, which means a big cut on the abdomen to do this operation. And now we do it a laparoscopic, which is a keyhole operation, and patients go home, literally 24 hours later. And some centers are doing day surgery gastric bypass, which is basically means patient can go home on the same day after the operation. So the benefits are it induces restriction, and it induces change in the hormonal balance in the body to improve metabolism, improve how the insulin works. And as a result, there will be a better control on diabetes, type 2 diabetes especially, and better control on gastric reflux problem. If anyone has a gastroesophageal reflux, and a Roux-en-Y gastric bypass surgery literally eliminates that problem after the operation. And also, as a result of weight loss, patients can benefit from coming off medication for diabetes, coming off medication for hypertension, cholesterol, and various other problems. And in women who have difficulty having children with PCOS or a fertility problem, they suddenly become fertile after the operation. Not just immediately after the operation, but when they start losing weight, their fertility tend to return to normal. In summary, I think the benefits are huge when someone who has a obesity problem, weight problem, and on top of that, they have this diabetes, hypertension, sleep apnea, gastroesophageal reflux, or infertility. So they get benefit from all these problems. In the bariatric world, gastric bypass has been seen as a gold standard operation, which means if a patient has an obesity problem with the other conditions, as I've explained before, diabetes, hypertension, infertility, or gastroesophageal reflux, that candidate would be a good candidate. But in the UK, the NICE has stipulated a criteria. Anyone with a BMI, which means body mass index over 35, with any of the comorbidities related to the weight, are suitable for gastric bypass. Or anyone who has a body mass index of greater than 40, with or without those medical problems, are suitable for gastric bypass. But then gastric bypass is even a better option for someone who has a higher body mass index and their eating habits. So, for example, if someone has a weakness for sweets, so the gastric bypass is a good operation because it works as a deterrent by inducing dumping syndrome. So when patient eats sweets or rich foods after a gastric bypass, what happens? The food goes straight into the small bowel, and then sudden release of sugars, which can induce various changes, increases fluid load there, which leads into patient experiencing cramps, runs, and also they develop hot flashes. Sometimes the patient feels like they entire energy has drained out of their body. So it is not a complication. Most of the times it is a tool to return them to good and healthy habits, telling them, please don't do it next time. It is also helpful in someone who has missing calories, which means they don't know where they are consuming calories, but they're gaining weight. And the gastric bypass is a good operation for those patients. And also someone who has a habit of comfort eating. Suddenly they feel depressed or feel low in the day, and they start eating too much food. No matter, they tend to grab onto anything is available. And because of how the gastric bypass works, by reducing the amount of food they eat and also the malabsorption, it is a better option. In my experience, one is very important. They need to be psychologically, physically ready to have the operation. And in order to make the patient prepare for the operation, information about the operation, benefits, side effects, and how they need to prepare themselves for the life after the gastric bypass is quite important. It is an operation which changes their life immensely, because before they start this process, they would be eating normal or larger portions of food, and suddenly after the operation, the amount of food they eat is restricted. It could be a shock to their body. Even they would expect this to happen, but when it happens, when the reality hits them, they find it hard to adjust to that. Sometimes patients do substitute eating to something else like smoking, alcohol. It is important for the physicians and the team involved in offering the operation to identify those problems at an early stage and support the patients so that they get better results in the long term. The quality of information is very important for the patient. Yes, there are general complications with any which are expected with any other operations like infection, bleeding from the wound, specific complications from the gastric bypass. The staple line, we use a special staples to cut and seal the stomach. And sometimes if the healing is not good, they have a weakness along the staple line, which means the stomach contents will come out into the abdominal cavity and make them septic. It is called a staple line leak or staple line deficiency. The chances of that happening is 0.25 to 2%, depending on patient's comorbidities. If a patient is diabetic, smoker, high alcohol consumption, high body mass index, or if they are on any other medication to suppress their healing process, would be at a higher risk. But in a norm, if in a person who doesn't have any of those risks, the chances are 0.25%. But there are other complications like internal hernia can happen. But in our practice, in my practice, what we do is we create some spaces inside, artificial spaces inside after gastric bypass, and I close those spaces to mitigate the risk of internal hernia happening in their life. We talked about dumping syndrome. That is a side effect. It's not a complication, but patients need to be counseled beforehand what is expected and what they need to do. And patients are expected to eat very small quantities after the operation. So what we ask our patients to do is gradually introduce their diet. First 2 weeks, they will be on a liquid diet, and then slowly progress on to a puree diet, which is basically blend everything what they eat. And then after 2 weeks of that, progress on to soft diet. So nearly 6 weeks after the operation, they progress on to eating normal food. And it is quite important for them to understand few key points. They need to chew food longer before they swallow it. Avoid any fizzy drinks. Avoid alcohol for a few months after the operation. Avoid mixing solids and liquids because the space is very limited. If they eat and drink at the same time, they will expect pain, nausea, vomiting, and sometimes the mouth can stretch. Exercise is very important because what happens is with the amount of food they are eating is restricted, their metabolism goes down and it tries to conserve whatever they eat. So to improve metabolism, to increase their chances of losing weight, they need to start doing some exercise. Regular exercise is quite important. Fluids are very important. I advise all my patients to carry a bottle of water with them and keep sipping, and because they need to start behaving like they're newborn babies. They can't keep gulping water because the space is very limited. And take their supplements regularly, not to miss those supplements, because that can lead to severe problems. And patients can, especially ladies, they start noticing hair loss. And it's better to start taking some hair, nail, and skin supplements to prevent that. Once the weight loss has plateaued, the hair loss will start to recede. In summary, gastric bypass operation is not a quick fix. Patients have to work very hard to lose weight. And if anyone says these patients have taken the easy option, I think they couldn't be any wrong.